Hello, I'm Dr. Paul Homoly, and this is our fourth video lesson in our series on distinctions in dentistry. My wife, sweet Lisa, has an unusual verbal pattern when she wants me to do something. Instead of telling me to do it, she'll ask me if I want to do it. For example, she'll ask, Paul, would you like to put your plate in the dishwasher? Or would you like to take out the garbage? What she really means is, put your plate in the dishwasher. Take out the garbage. What she says versus what she means can be two different things. Patients are no different. For example, your new patient, Hank, says, I don't like the appearance of my front teeth. Now, what he might mean is, I want to feel more confident when I speak in front of people. You see, this is important because when dentists hear Hank say, I don't like the appearance of my front teeth, so many of them start thinking now, how can I fix Hank's front teeth? Maybe veneers or maybe Invisalign, then veneers, right? Well, here's the problem with this. The moment you start thinking about Hank's technical solution, you stop being curious about why he wants his appearance improved. You may figure out the best technical solution for Hank, but if you don't know why he wants them fixed, your case presentation becomes process-centered. Process-centered conversations focus on explaining procedures and describing the steps to fixing his teeth. Here's something to think about. How many different dentists can Hank go to and hear a process-centered presentation about veneers? How many? The answer? All of them. Process-centered presentations don't distinguish you in patients' minds. If they've heard one, they've heard them all. What will distinguish you are benefit-centered presentations. These presentations focus on why patients want their teeth fixed versus how you plan to fix them. Now, there are 3 steps to offering benefit-centered presentations. And let's use Hank as an example. First, discover why he's bothered with his front teeth. Then, after he tells you about his concern about his appearance, ask him something like, well, Hank, give me an idea about when your appearance bothers you the most. Is it at work? Is it at home? You see? So Hank answers saying, well, it's a problem at work. In my new role, I'm speaking in front of people and I'm self-conscious about my teeth. You see, Hank being self-conscious at work constitutes what I call his disability. Disabilities are how dental conditions hinder patients' lifestyles. Step 2, by learning his disability, you now know his behavioral benefit. Hank wants to look his best when speaking at work. Behavioral benefits are always emotional opposites of disabilities. Step 3, when offering benefit-centered presentations, be sure to include his disability and behavioral benefit. This can sound like something like this. Hank, I know right now you don't feel confident when speaking at work. I recommend we remove the darkened chipped enamel from your front teeth and replace it with a new enamel-like material. And at this point, I'd show Hank a before and after photo of cosmetic dentistry. Then I'd say, Hank, this procedure will help you build your confidence in your appearance, especially when you're speaking at work. This benefit-centered approach to case presentation will distinguish you in Hank's mind because you've linked relief of his disability and behavioral benefits to your technical solution. Being distinguished in Hank's mind influences him to accept your care, guards against losing him from sticker shock, and reduces the likelihood of him seeking second opinions. I hope you enjoyed this lesson on process versus benefit-centered case presentations. If improving your new patient experience and treatment acceptance is important to you, consider visiting Treatment Acceptance Mastery. Thanks for listening.